Hey, and welcome back to another episode of Hiss and Tell. This is episode 42. Before we get into today's episode, if you like this podcast, I would be super grateful if you would take a second and leave a rating or a review wherever you listen. It really helps more cat guardians, cat people find the show. Also, if you have a question about cat behavior that you'd like answered in an upcoming Ask the Behaviorist episode, you can submit it on our website, which is Hiss and Tell Podcast, or send it to us on our Instagram, which is Hiss and Tell Podcast. Okay, now that all that housekeeping is out of the way, today's episode is all about feline hyperesthesia syndrome. It's a condition that a lot of cat caregivers have seen, but few fully understand. It's often described as a neurological issue or behavioral issue or sometimes a dermatological one, but as you'll hear in this conversation, the truth is maybe somewhere in between. Okay, so now that I blabbed on for almost a minute, let's get right into talking about feline hyperesthesia. Hi, and welcome to another episode of Hiss and Tell. I am your host, Christina Wilson, and with me today is Dr. Stefania Uccheddu. She is a veterinary doctor and diplomate at the European College of Behavioral Medicine and Animal Welfare, and also has a degree in psychology, human psychology. So welcome, Stefania.
Thank you. Thank you.
I'm so glad that we finally are having this chat. We've been trying to arrange it for months. So
Yes, that's true.
here we are. We're going to be talking today about feline hyperesthesia, and as I was telling her before we started recording, I have a special interest in this, not only because I do sometimes see clients who have cats with this, but because we have a cat named Babby who has feline hyperesthesia that we have been managing since she was obviously tiny. We got her as a singleton at 2 days old, and so I have also wondered a lot of the time how much of it comes from the fact that she wasn't able to be socialized properly and regulated. But we will talk about that as we go in this conversations. Can you tell the listeners a little bit about exactly what is feline hyperesthesia? I think a lot of people describe it as either neurological or dermatological. What do you think it is?
Wow. Well, thanks for this first question that actually is the most difficult one.
Sorry.
So actually, let's consider hyperesthesia as a kind of hyper sensitivity of the cat. So it's a syndrome, is a condition, but actually, after we consider the medical part, we should consider that also how the cat and what the cat is feeling at the same time. So probably, if we consider this part, we can say that it's a kind of hypersensation of the stimuli that are around the cat. And if we consider the medical part, probably is a condition that is in between neurology and behavior. So we cannot really highlight something. So it's not just behavior and it's not just neurology, but it's like in between. So actually, for this reason, even our paper focus on both parts. And we collaborate a lot. So anytime that we have a case of hyperesthesia, we work together. So normally we have cases that arrive from dermatology because normally this is the first point. And after we exclude the dermatological part, then this cat start with the neurological and behavioral consultation. So it's exactly in between, and probably we do not know like all details about this syndrome, about this pathology. And if we check the literature, we are not expert at the moment, but for sure, what is super important is to have a kind of respect of this condition, because I think sometimes it's really, really underestimated.
I agree. Can you describe what people might see in their cat if they're exhibiting the symptoms of hyperesthesia?
Yes, of course. Actually, there is, I think the most evident part is the rolling skin. So this twitching movement that you can see in the cat normally is something that is really evident and is normally what the caregivers are going to tell you as the first thing. So normally it's like, okay, yeah, I see this movement, but sometimes they describe also some hair movement, some facial different expression. And actually, in my most severe cases, aggressive behavior and also this kind of hyperactivity, especially at the end of the day. So they said, oh my God, so my cat is mostly normal during the entire day. And this is strange because normally people work during the entire day. So
Yeah.
it's like, okay. But then when I come back after my routine, I come back and my cat starts running everywhere. So it
Mm-hmm.
seems crazy. And this is normally the definition that you can receive from the caregiver that, yeah, it normally every day start running all around and it can start being aggressive to the other cats or to me, and that's it.
Right.
And sometimes this is described as something that is normal for cats, but it's
Mm-hmm.
not. And starting from this point, especially if the cat start biting the caregivers, then you have the problem. But sometimes, probably if I go now and I start talking with people at the clinic right now, and I ask, how many of you are aware that this is a problem for a cat? I mean, I'm sure that probably 50% of people are not aware that this can be a problem.
Yeah. I wanted to add also about the tail mutilation that can happen in a lot of like the more severe cases that
Mhm.
cats can start really attacking their own tails and sometimes
Yeah,
really mutilate them to the point
yeah.
that they have to be amputated. Yeah, and our cat who has it, she has trigger spaces, which I think leads us to talking a little bit more about the behavioral implications of this, but if she goes to certain perches in the house, she will have an attack. It's almost like these certain spots lead her to remember or to cause her to have this. So we have
Mm.
to keep her from those spots and then she's fine. It's very interesting to see how spaces in the home will lead her to have an attack rather than a time or, and any interactions with other cats.
Well, just something that is really, just to add something to your description, sometimes also we can observe some cats that are super attracted by like something that is flying outside. So birds,
Mm.
for example, they start chirping this, chirp, 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 chirp.
Yeah, yeah.
Then they start licking or biting the flank, or they start to have this muscle spasm, not just the rolling skin, but this spasms. It's
Mm.
really, it seems that they are ready to this kind of predatory behavior. So it's like,
Right.
I'm ready, but then you can really observe this kind of frustration that is like more and more and more and more, and they start
Mhm.
attacking themselves too. So you talk about tail chasing, but
Yeah.
sometimes they attack any other part of the body, and they start running. So it seems that it's a kind of sequence of predation, but it's not, and that
Right.
we have the same level of activity. And this is really curious. And when you start talking about this part, I said, yes, this is true. And actually, I think this part is really important whenever we are considering the pathophysiology of this syndrome.
Right. I think people really want to, and I've been guilty of it myself, trying to label it as one or the other when I think, is it neurological? Is it behavioral? Is it physiological? Is it behavioral? When I think, as you said, it is very likely to be a combination of both. So that leads me into, obviously, do you see this as a single syndrome or more of a collection of signs with different underlying pathways?
Yeah, normally you can have different presentation actually. So
Right.
I think I don't have like the same condition. I mean, normally I have different presentation, and
Mm-hmm.
actually for some cat is more similar. So sometimes we consider more the dermatological part because they have this like this movement that at the beginning you said, no, my God, this is pruritus for sure. And
Right.
sometimes they start biting. So you said it's a kind of hyperesthesia in the meaning of the neurological part. So it's like it's a pain. Sometimes we also need to consider that some pain condition can be there too. So this is the first part. At the beginning, you need to exclude all this obvious part, but for sure,
Right.
we need to consider each individual as completely different. Probably something that I observe in like probably 99% of the cat is that normally they are super sensitive to like to any kind of sound, and
Mm-hmm.
they sometimes caregivers start describing the cat, and they said anytime that there is sound around, there is a kind of noise, you can see this movement. So they are like more super activated by noisy. So it's like this is super common actually. But for the rest, I think it's you can observe a huge variability.
Right. So I want to get into talking about your paper, which was super interesting. Which for our listeners, I will put a link to it at the on the podcast website. It's long-term clinical response to medical treatment, behavioral therapy, or their combination in cats with hyperesthesia syndrome. Um, I really loved this paper and thought it was so interesting. Do you want to, for our listeners, just tell a quick overview of your study and what you guys did?
Yes, thank you. So actually, you can read in the paper that we have two big group actually. Then we can see also more division. At the beginning, let's focus on the main division. We have a neurological group and a behavioral group. And was interesting because normally the neurological group is the group that didn't receive any behavioral modification, just drug. And the behavioral group is the group that received neurological evaluation, behavioral evaluation, sometimes drugs or not, and behavioral modification all the time. And was interesting, I think that we were able to find a resolution. So we find a treatment in both group. So neurologists, we work independently. So at some point we meet together and the behavioral group and the neurological group, and they said, okay, but in any case, we collect good result. Okay. But the difference was that in the case of the behavioral group, we use all the time the behavioral modification. And was great in long term. So actually, for sure, we can give a perfect treatment even just with drugs.
Right.
This is for sure. But actually, if you want to collect better result in long term period, actually, you need a behavioral modification.
Of course.
And this is important because not because I'm the behavioral part, the behavioral.
Yeah.
Okay. Not because actually I think the behavioral group win.
Yeah.
But this tells something about what hyperesthesia is, probably.
Right.
Okay, because for sure, I mean, I had in my career a really severe case of hyperesthesia, and this start attack the caregivers, and they were not able to enter in their place in their home for 3 days.
Oy, yeah.
So, okay, and I'm not saying the drugs are not important. I mean, are mandatory. Sometimes, I mean, you are receiving the case and it's like really severe. So drugs are super important. But the behavioral modification is important too, because probably this cat need a better life.
Yes.
Need to change something, actually. So they need to receive something different. Because, of course, we love cats. We like to have cats around. But sometimes probably we need to transform something in the environment. So probably these cats are more sensitive because we can, I mean, at the moment we are not expert in this part, but probably the genetic part of this cat is different. So they are more sensitive. Probably in nature, they would be like great because they are more sensitive so they are able to see if there is like something that is negative going on, or they can prevent anything that is dangerous. So but in our places, in our houses, sometimes probably we miss something.
Yes.
So behavioral modification sometimes is the difficult part because each individual is different.
Right.
So it's not just, okay, I open the door and they can go outside in the garden.
Right.
Okay, sometimes they can be scared, for example. So even to be in the garden is not fine. So this is the difficult part. Even if you find the secret key, this is the best result that you can get.
I understand. So you're suggesting that behavioral intervention for cats with feline hyperesthesia could be adding environmental stimulation. It could be adding intellectual stimulation so that those cats who have feline hyperesthesia, possibly stemming from frustration, like predatory frustration or anxiety or just a lower baseline threshold, have more to do in their brains so that they are less likely to get over threshold and have an attack.
Yeah, exactly.
Right.
And actually, I think that really this is super important. I mean, for each individual, we should find the right way. I mean, for some cat, you can find some social stressor, for example. Okay, for some cat is frustration because they cannot pray, or for some other cat is some olfactory issue. So I think it's really difficult. This part is really difficult because you really need to observe details in this
Yes.
case. So the medical treatment is, for me, is, how can I say this in a really polite way, is the easy part. Easy part because it's now we have like gabapentin, we have fluoxetine. So
Yeah.
we have something that is really okay. I know how to do this, but sometimes behavioral modification is not a protocol.
Right. It's true. It's not. Yeah, you have to really go down. When we were trying to figure that out with our cat who has it, we had to try so many different things until we figured out exactly what she wants. She wants to have her own room where she can go to have her alone time. And then we landed on these little hunting mice that are like little plastic toys that look like mice. They're puzzle feeders. And we just fill them with her dry food for the day and close it so it's just one tiny hole. And she will work with those all day long. She loves them. She's obsessed with them. And if she gets to the point where she hardly ever has attacks anymore, but if she goes to one of those spots where she's triggered, all we have to do is give her one of those and she's immediately out of it because her brain is occupied and that's what she wants to be doing. So, but it did take quite a lot of trial and error of enrichment boxes and bird feeders, and doing all the things that we normally do for the rest of our cats anyway, but figuring out exactly what worked for her to distract her a little bit differently abled brain to figure out exactly what it is that's going to pull her out.
Yeah.
But it was worth it because now she's much better.
Great. And actually, I think that's something that we need to consider too. And this is like another important consideration that we are still studying at the moment. But sometimes, for example, we do not consider that cat went to a different domestication process.
Yes.
So, for example, if we consider dogs, any dogs that I see every day, it's like I can see this attachment bond with the human being. I can see a pattern, a behavioral pattern. Okay, I can see a behavioral pathology, but it's like dogs are like really, you can describe a behavioral pattern. And for cat, actually, you really see some differences for each cat. And you can see that sometimes some cats were born in domestic places, but then you have cats that they were born in the street and they are something in between feral cats. So it have a huge difference, I think, in the genetic part. And sometimes probably our cats are not really ready for being just domestic cats. Sometimes you can have this feeling, and I know that this is not really scientific at the moment, but sometimes you can have the feeling that they have this wild part that is like strictly there. I mean, it's like, wow. And you can sometimes have some patient that they are still able to pray and they were to catch a pigeon. Oh my God. I mean, wow. They called me and the owner said, oh my God, it was able to prey a pigeon that is not small. I mean,
yeah.
So you can see that they have this wild part, and probably is something that we still need to study much more about this topic.
I agree. Do you think that, many of the behaviors that are associated with this disorder, kind of the rippling skin and the aggression and the grooming, they often can also appear, as we discussed, in cats who have chronic stress and frustration, even though it's a little different. But do you think that this syndrome could represent a failure of sort of emotional regulation in some
Mm.
cats, and that's why medications like fluoxetine can be helpful. And fluoxetine, for listeners, is an SSRI. It's Prozac for cats.
Yeah, actually, yes. And for this reason, even in the paper, we talk about a kind of primary dysfunction over the cortical limbic system.
Mm-hmm.
So probably it's a kind of behavioral response to this negative affective state or to frustration.
Mm-hmm.
So if you ask me, okay, where is the difference between a chronic stress and a hyperesthesia? Can you describe all the details? I don't know, actually. I mean, yes, for hyperesthesia, I could observe this and this and this. But then for chronic stress, probably I can observe, yeah, probably for chronic stress, I can observe something more similar to the Pandora syndrome. So
Mm.
sometimes for chronic stress, I can have idiopathic cystitis
Yes.
and I can have gastrointestinal problem too. So
Mm-hmm.
chronic stress it's a huge, but sometimes in Pandora syndrome, probably we can observe also some cat with hyperesthesia. So this stress part, it's really important for cats. Actually, starting from human psychology, even in human psychology, sometimes the concept of stress now it's going in another direction. So sometimes we don't talk just about stress. We talk more about low level of resilience.
Mm-hmm.
This is another concept that I think it's important talking about cat with hyperesthesia. So sometimes we can observe this cat with a low level of resilience. So they have this kind of deprivation that so they don't see, they cannot play, they cannot see new stimuli. And then at
Mm-hmm.
some point when they are 5 years old, they move to another place and they change their routines, but they don't have any kind of resilience, so they can deal with a really high level of stress.
Right.
And in the future, probably we should consider also this part because, for example, in Italy, many cats live just indoor,
Mm.
for example, so they are not um, they are not able to cope with new stimuli, for example. They're just not used to this. So
Right.
anytime that there is something new, so they change furniture or anything else, there is a new member of the family, a new partner, and that's it. So they can have this this stress, this high level of stress. So I think this topic is something that should be considered in the future a lot. So are we able to deal with modern cats, or maybe we should consider new guidelines,
Mm.
considering also the genetic part or anything else. So it's a question that is still in my mind. I'm still considering and reconsidering all the options.
Yeah. Are there parallels between hyperesthesia syndrome and other stress-related or compulsive behaviors that we see in cats? Like, how's it different from cats who just compulsively chew at their fur or pull their fur out or things like that?
Yeah. Actually, a few years ago, I published a paper about compulsive disorder
Mm-hmm.
in cats and dogs. And we work with a human psychiatrist just to understand better the compulsion. I mean,
Right.
it's a concept that if I say the word compulsion, I will, oh my God, if I said obsessive compulsive disorder, it's something that, okay, I'm not fine with this word. But
Yeah.
actually, when I start reading and studying the literature, and I talk a lot with the human psychiatrist,
Mm-hmm.
they said, remember, Stefania, that an obsessive compulsive disorder start as a coping strategy.
Mm.
Okay, so sometimes animals start with a repetition because they are waiting. So they're waiting that the environment is going to be better at some
Right.
point. Okay, so sometime in nature, sometimes there is a disaster, and you can observe some stereotypy
Mm-hmm.
even in wild animals. But then there is a resolution of the problem, and then that's it.
Right.
In domestic animal, probably sometime there is probably even in this condition a genetic predisposition, but actually we have to consider that probably even the hyperesthesia is a coping strategy at the beginning. So they are trying to deal with the environment. Okay, so they would like to pray, for example, but they cannot. But they learn. I mean, they are able to pray.
Right.
So it's a kind of result of a continuous frustration, probably. And even in the case of obsessive compulsive disorder, we start with a coping strategy. So, for
Right.
example, we study the licking behavior, licking, but that's it. You are waiting for something else. Yeah, I mean, your question it's really fascinating because probably in the future we are going to study more hyperesthesia and OCD as a coping strategy.
Yeah.
And then you can observe pathology if the coping strategy is not enough anymore.
So the study noted, towards the end, it noted that inadequate socialization during critical development periods could play a role. And that made me wonder could feline hyperesthesia be more common in singleton cats because they didn't have really any socialization?
Actually, this is quite common, and it's common also in cat with Pandora syndrome, for example. So all these urinary problems and
Right.
gastrointestinal issue and blah blah blah. So even in this case, probably you can observe difficulty in dealing with like really small stress because actually if we consider, for example, the mother, when you observe mother and the kitten, sometimes mother they start to create some small episode of difficulty event or something that is more difficult for you, or they decide to leave the box and leave the kitten alone. This is stress. So sometimes we don't, I mean, consider the mother as something like that is holy mother, but no. I mean, the mother is able also to teach when you need to stop, when you are able to deal with frustration or not. Stop doing this. Okay, let's do this. So the mother is the first teacher.
Yes.
Of probably of the hypothalamus, hypophysis, surreni. So it's something that teach how to deal with stress during your life. So sometimes, for example, when people said, "Oh, but this kitten was 1 month old and the kitten was able to eat, so we separate from the mother." I said, "Oh my God, why?"
Yeah.
The first month and the second month are both so important in terms of learning, in terms of communication, but also in terms of deal with stress.
Right.
And
Absolutely.
this is the most difficult part because as a human being, I can give milk and food, but I cannot teach anything about this stress. Anything.
Absolutely. Yeah. How much do you think that there's any kind of epigenetic role? Have you heard of anything about like a mother cat who might have feline hyperesthesia and then her children having it? Do you think that there could be any genetic pass down of this or any learned behavior in cats?
Well, actually, if I quick check all my patients, it's more frequent to have orphan than kitten to learn this part. It's definitely more frequent to be. So is the worst part is to be orphan or like to be like being separated from the mother.
Too early.
Yeah, too early.
So that makes a lot of sense that you didn't learn how to cat appropriately or how to regulate emotions from your parent.
Right.
Yeah. So that makes a lot of sense and makes me understand more our particular case who we were her parents and we don't know how to be a cat. We're just two humans. So we could meet her physical needs, but we could not meet her behavioral needs until she was old enough to get vaccinated and meet the rest of our cats. And by then that socialization window had closed. So unfortunately. So when you talk in the study about behavioral therapy, what sort of interventions were you talking about, and were people doing any interventions like during an attack?
Okay, so normally the first part is to respect the 5 pillars. And the 5 pillar normally are like super basic part about the perfect place for cats. Really normal, like, are you sure that there is any privacy space for your cat? And they said, yes, of course. Okay, show me the privacy. And sometimes there is a no safe area for cats. Or
Right.
do you respect like some in this case some predatory behavior? So is your cat able to prey, of course, not other animals, but for example,
Right.
do you provide any appropriate toys, or do you play with your cat, for example, in this situation? So or you respect the olfaction, do you respect also everything that is related to resources, let place, or like uh, food, and etc etc. So at the beginning I start really from the basic, and sometimes I'm really surprised that some cats are they just spend time during the entire day just sleeping. So the normal routine is sleeping, 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 eating, sleeping, eating, sleeping. And so the following step sometimes is a kind of depressive state.
Yeah.
Unfortunately. So in veterinary medicine at the moment we are not able to describe depression, but sometimes probably in the future we are going to see more and more cats that they start with hyperesthesia, but then they can show some depression too. Let's see in the future. So it depends actually on the patient, on the cats, but normally we ask a giver to create a positive interaction and to create a correct communication. For example, respect the sleeping time of your cat, and respect the playtime. So you can interact with your cat, but respect, for example, if your cat, for example, want to stop playing, and sometimes they want to pet the cat in any case, and the cat start biting, for example.
Yeah.
So we teach basic rule about communication. Actually, I don't like to teach anything about how to deal with the aggressive event. I like to work on prevention.
Sure.
So I don't have like a perfect recipe in case your cat is going to attack you. So I don't know. It's more like we are going to work in a way that we avoid any negative interaction between you and your cat.
Of course. Oh, and when I said attack, I should have clarified. I didn't mean your cat is attacking you. I meant if your cat has symptoms. We call
Ah,
it when our cat has
okay.
when
Okay.
our cat has it, we call it an attack because she's attacking herself.
Okay.
She's
Okay.
having an attack of hyperesthesia. But of course, if your cat is attacking you, there's nothing, you need to protect yourself and get away from the situation. Is there anything that people might do that would worsen the symptoms?
Yeah, for sure. No punishment at all. No yelling
Yeah.
to your cat, actually. And don't try to hug your cat or kiss your cat at the time, because it's going to be really dangerous.
Yeah.
And probably don't kiss your cat in many other
Yeah.
circumstances. And at that point, they ask me, but I cannot kiss my cat in the belly. No, sorry.
Yeah, with these cats, it's best to always ask for consent and permission so that you don't get your face ripped off.
And it's like a great idea, a great
Yes.
point. Yeah,
I think,
because I think we do not respect a cat. Really.
yeah, I think always asking for consent. And again, a good way to do that is to just extend one finger and see if the cat comes up to you. If they do, you can pat them. If they don't, they just don't feel like it right now, and just let them be. They're doing something else. Just like we don't always want to be touched or hugged or kissed. Sometimes they
Yeah.
don't either, and that's okay. So your paper looked at medical treatment alone, just fluoxetine, SSRI, behavioral therapy alone, which we've just talked about, and then a combination of the two. So three
Yeah.
distinct groups. And I believe all three of them had success, right?
Mhm.
They were all successful, which is cool to see. And then in the medication categories, cats were still successful after the medication was withdrawn, right? After a year, they still were asymptomatic, which is great. So what stood out to you most when looking at these long-term outcomes? And also, I wanted to say the combination group that was the medication and the behavioral therapy, it wasn't just fluoxetine. There was also Gabapentin used as the medication, which for listeners is not an SSRI. It's actually like a nerve pain medication. So just putting that out there for people who have not read the paper yet.
Actually, sometimes my first choice is actually Gabapentin, because you are going to receive an immediate result.
Right.
So sometimes my first choice, it's like 2 Gabapentin for this reason. And sometimes I can start with fluoxetine at the same time, because of course fluoxetine, it's easy. If we talk about how many times should I administer the drugs to my cat? So because fluoxetine just once per day in the morning, that's it. So talking about also how easy is to give pills to your cat, which should consider also all these variables. So actually in literature, you can find fluoxetine, you can find gabapentin, and are both reported as a successful therapy for hyperesthesia. And actually, even in our group, we use both successfully. But if I have to give also some practical consideration, this is also the reason why sometimes gabapentin will be your first choice, because it's like immediate. Fluoxetine sometimes is going to take at least 20 days, even if, for example, if you start and sometimes you are going to receive the first result in few days, actually. This is great, but if you are with a really severe case, for example, as I mentioned before, the cat that was so aggressive that the caregiver were not able to go home for 3 days, I start with everything. So fluoxetine and gabapentin, like with maximum dose, for sure. So it depends also on what you are observing. And neurologists are more, they respect more a kind of protocol. So my colleagues, they said, okay, we start with fluoxetine, that's it. But since I have the opportunity to work with neurologists and with the behavioral modification, sometimes I try to adapt the protocol. And actually, when we were able to compare the result, we had like great result in both groups. So was great. And I think this is important also because sometimes it's more common that you can get a neurological consultation, but it's probably sometimes depends on where you are in the world. Sometimes it's more difficult to have an immediate behavioral consultation.
Right.
So I think these results are important because, okay, if you suspect any hyperesthesia, let's start with the medical treatment and then look around for a behaviorist, for example. So you're going to have a positive outcome even in the long term. Actually, a limitation of our study is that we collect follow-up for 1 year. And if you ask me, okay, why for 1 year? Well, actually, normally we observe that 1 year was enough to say, okay, we are going okay or not. But probably in the future, we are going to collect results, outcome in 10 years time, because I think it would be more important.
Yeah.
And to see how it's going on, because 1 year is okay, but probably is not enough to understand how the hyperesthesia is going to evolve somehow.
I suspect, and again, what do I know? But I suspect it may kind of go this way, depending on stressors that wax and wane in the household, at least from observation in our household. Based on your findings, what would successful management of hyperesthesia realistically look like over the long term? Would it be, just managing behaviorally? Would it be the combination of the drugs and then fading the drugs out to behavior? What do you think a lifetime management is?
Probably, in long life term, I mean, I will go for behavioral modification and but more sometimes I like to talk about optimization. So it's not that we are modifying something, we are trying to adapt our houses to cat life, actually. So it's like it's a long life project. And I think talking about long term, it's also in my therapy, my dream therapy, I include also more awareness of the caregiver. And for sure, sometimes I think it can be useful to use gabapentin for if you are suspecting that something is going on. For example, we are going to move, or there is your parents that are coming, and then I start with gabapentin because it, as I said before, can be useful to have something that is going to work really well and really fast.
Right.
So it's a kind of emergency kit also for family, because sometimes after 5 years, they call you back and they said, oh my God, you know what? That I observe again skin. And it was after 5 years. Where is the problem again? We didn't solve the problem. But this is true. You are not going to have a kind of treatment forever. It's something that's part of your cat for the entire life. So
Right.
probably you are going to observe again rolling skin, or sometimes you are not going to observe hyperesthesia anymore. But after a few years, these cats are going to develop like some urinary problem, for example. So sometimes, and I think this is the concept of Pandora syndrome that is super fascinating. So it's not that you are observing specific pathology, but sometimes it's a syndrome, because after 3 years, you're going to observe different signs just because your cat is showing stress in a different way.
Right. So if you were going to do a follow-up study, what would you want to measure? Is there something else you'd want to add on? Is there anything else that you would want to study about hyperesthesia?
Okay, thanks. Actually, it would be really nice to see if the caregivers observe any other episode, for example, during the following years. So, you observe any other episode? Did you correlate or did you associate this new episode with a new stressor, for example? Did you add, for example, any new members in the family? And have you stopped the therapy? Because sometimes they try to stop the therapy, or they decide to do this. So actually it would be really nice to see in the long term if there is this kind of flotation, for example, or after you treat once, it's just fine. So
Right.
I would be really curious to check all these variable in the future, and how many time, for example, is going to be necessary to use medical treatment for a cat with hyperesthesia. So in a entire life, how many time are you using the therapy? Or probably if it's a severe case, maybe you didn't stop anytime the therapy for, so you use medicaments for the entire life of the cat. So it would be
Right.
really nice to check also these medical treatment area.
So is there something that you would like veterinarians and behaviorists to take away from your research when they work together or independently on these cases?
Yeah. So I think the first point is do not underestimate hyperesthesia. So respect caregiver description. So if they describe any of these behavioral issue that are going on, do not underestimate. Oh yeah, it's a cat. That's it.
Right.
And if you are if you have any question, just ask to a neurologist or a behaviorist. If you want to start with medical treatment, you can do it. But remember that behavioral modification and environment are so important in long term. So in the emergency, you can use the therapy because now the protocol is quite good. So you can use the medical treatment, but please remember also that you need to respect cat's emotional and behavioral needs. So this is really an important part for the future of the cat.
I totally agree. And if people start with the medication, would you recommend that they eventually fade the medication, or do you think some cats need to be on medication for life?
Hmm.
What
Well,
role do you think medication plays?
normally after 1 year, I try to to stop the medical treatment. So
Mm-hmm.
I start reducing the dose, and I want to see what's going on.
Right.
Normally, I try at least once after 1 year. And then I see maybe sometime it's enough for the cat and we just let's stop the medical treatment and that's it. Sometime when we reduce the dose, then we realize that rolling skin is already there and we are not able
Mm-hmm.
to deal with the cat anymore. So, okay, and let's go back actually.
Right.
But I think the medical treatment is something that is useful, but really we use until it's necessary, not necessary for the entire life of the cat.
Right. So not as like a blanket treatment.
Yeah, exactly.
Sure. Is there something that gives you the most hope when you're treating cats with hyperesthesia today, especially after doing your study?
Okay. So I think that whenever we start talking about awareness in the
Mm-hmm.
family, I think this is a huge progress, actually.
Yeah.
Even because sometimes people they decide to adopt a cat and they are not able to they are not aware about anything about cat behavioral and emotional needs. And I
Mm-hmm.
think at the time that they deal with the pathology, they start considering more this part.
Right.
So now there are more and more podcasts and courses for caregiver, and this is so important. So probably in the future we are going to see cases early, and so we can give up better treatment, and people are going to be more aware about behavioral consultation too. So I
Mm-hmm.
think this is a good point for the future of hyperesthesia. So probably we're going to see more cases, but early probably, and people I suppose that are going to be more aware about communication and behavior and emotion. So probably in the future this syndrome is going to be we are going to see this syndrome in a different way, I
Yeah.
think.
That sounds good. I hope so.
Yeah,
I
me
hope
too.
so. Great. Well, thank you so much for coming on the podcast and for talking about your study and for all your work to help these cats with feline hyperesthesia. I really appreciate it.
Thank you. Thanks a lot.
Thanks so much for listening to the show. If you're looking for one-on-one support with behavior issues like litter box problems, aggression, anxiety, or multi-cat dynamics, you can find me through my behavior consulting business, Catitude Adjustment, at catitude-adjustment.com. If you like the episode, please consider leaving a rating or review. It really helps us grow. For more episodes, show notes, and resources, head to hissandtellpodcast.com. Huge thanks to Cat Beats for the music, and I'll see you next time.